Hey, what's up, everyone? It's Drew here, back at FFAS 2018. I am joined by
Dr. Jim Shire.
Dr. Jim Shire. Where are you located?
I'm in Chattanooga, Tennessee.
Okay, cool. And what kind of practice do you have?
I'm facial plastic surgeon. So
Okay.
we're strictly aesthetic facial plastic surgery.
Okay, beautiful. Awesome. So we're here at FFAS in New Orleans. You're giving a couple presentations, correct?
Yes, I am.
You want to talk a little bit about those?
Well, I'm giving a talk on facelifting and the importance of how preparation before anything is done is probably one of the more important steps. So many people get I guess, bogged down with the ideas of what technique are they using or what surgical procedure is going to be done.
Sure.
But if your planning in the beginning isn't proper, it doesn't make any difference.
Gotcha.
Because you're starting off on the wrong thing. So,
I love it, yeah.
The things that really make an facelift important is that it looks natural, like no one was operated on.
Sure.
So that's the real topic.
You don't want the wind tunnel look, yeah.
Well, and so it's design. So it's incision designs, if placing them properly, and if everything's done correctly, then even your hairdresser won't know.
Okay, cool.
Yeah.
Awesome. So interesting. So I've been talking to a lot of doctors. Are you, when you're doing your facelifts,
Yes.
are you combining any other approaches, whether it's fillers or anything else, or is it just strictly surgical facelift? Or because a lot of the doctors are talking about how they're kind of bringing in different types of approaches to get the best effect. Like, how do you kind of approach that?
Yeah, it depends what you mean by the best effect. And I think a lot of these people that are doing that, again, are treating minutia and not the big picture.
Okay, let's talk about that.
And so a lot of what I see when people start adding all these add-on things,
right,
is people don't look natural anymore.
Gotcha.
They're puffy.
It's just too much.
They're full. They're puffy. They don't look refreshed.
Right,
and that's
right.
what we're looking for. We're looking for
Okay.
a refreshed appearance. And so, yes, we do those things, but it's not, if it's something you need, we'll do it. If it isn't. So
Sure.
that's the art of what we do.
Yeah.
It's not a cookbook.
Right.
So what I do for one person is not what we're doing for the next person.
Gotcha.
And so I think it's oversimplification when you talk about that.
Okay.
And I think too many people, again, get bogged down in, everybody's doing fillers here and fillers there. I got to do that now. And most of the time, it's not needed,
Sure.
or it's inappropriate.
Cool. I like that perspective. You're also giving a presentation on complications, right?
Yes.
Talk to me a little bit about that.
I think it's important because, and I think that's one of the nice things about this meeting, is that it's a small enough meeting that we can talk to each other. And a lot of meetings are meetings where people have a presentation and they're basically bragging about what they're doing.
Right.
I'm just being honest. They're bragging.
100%, yeah.
And no one admits that anything ever goes wrong.
Right.
Or that they have a problem. But it does.
Obviously, yeah.
So it's critically important that you know what those problems are.
Sure.
How to avoid them. And if you actually get them, what do you do for them?
Right.
And so when you have a conference and you have a segment on complications with experienced people that have been through it a lot, I think that's the real learning, because everybody comes back from a meeting learning something new,
Sure.
and they're going to try it, and that's where the problems happen.
Yeah.
So you need to know where the bumps in the road is, so you can avoid those bumps.
Of course, yeah.
Yes.
I love that because, I mean, you hit the nail on the head when you talked about how there's some of these shows where the doctors are, we all know no one's perfect, right?
Yes, yeah.
But they're not being vulnerable, and how can you learn if you're not going to be vulnerable,
Right. So so you have to be able to, because it happens to everybody.
Yeah.
Be forthright.
Mm-hmm.
And a lot of times you're going to say, hey, this happened. I don't know why it happened.
Right.
Does anyone here know what's going on?
Sure.
So this is a good opportunity for a learning, as a learning environment.
Great.
Yes.
All right, last question.
Sure.
Tell me a little bit about your practice and what you specialize in, and maybe some stuff you're looking forward to taking back to your patients that you've learned, from this show.
Yeah. Well, I've been in practice a while.
Okay.
I think I'm going on 29 years.
Nice.
So
Beautiful.
It's comfortable right now.
Yeah.
I've gotten to that point where I'm comfortable because it's become simple. I simplify things because my primary goal is to make a patient happy. Because if they're happy, I'm going to be happy. And so when I go to a meeting, I'm not here to bring back the new greatest thing and try it out. I'm here to confirm what I'm doing is correct, and are there tweaks we can make to it. And so I'm at that point. I'm not at that early learning curve area. So
Sure.
Meetings are different for me now.
Yeah, okay.
And that's what's great about this, because it's a senior meeting, because a lot of people here are in my same situation, and they're
Right.
doing the same thing.
Right,
so,
right.
so that's very good.
Cool.
Because my practice is facial plastic surgery, and I would say 90% of it is aesthetic
Okay.
in nature.
Awesome. Good stuff. Well, thanks, Doctor. Thanks for joining us, and
Great.
have a good rest of your meeting.
Great. Thanks.
Yeah.
Nice talking to you.
Yeah, of course.
All right.